Facebook Live, Partnering with Food is Medicine. I'm Shannon Andrews. I'm the Chief Equity and Inclusion Officer here at Cook County Health, and I'm so excited today to be joined by our esteemed panel as we recognize Black History Month. At Cook County Health, we are always looking for opportunities to lift topics up that we believe are relevant to health equity in the communities that we serve. Today, we're going to be discussing food as medicine, which is not a unique concept to the world, but we believe that we've approached it in a very unique and authentic way because we're looking at it not only the role that it plays, but the impact that it has uniquely on the communities that we serve. And today we're going to be talking about how specifically it impacts the Black community. What better way to lift up the legacy and the importance of Black History Month than to talk about topics that are relevant to the community, that are timely, but most importantly, from our perspective, are opportunities, again, to make an impact on the quality of life and health for those communities that we serve. So we're excited for the conversation today. Before I have the panelists introduce themselves, I do want to, for a quick housekeeping note, let our audience, for those of you who have already joined, know that you can ask questions in the comments at the end of our panel discussion. And really, it's going to be a discussion because we want to share information and perspectives that we believe can be relevant to the community and the journey as it relates to how do we become healthier and how do we thrive. So if you have questions, please feel free to add those to the chat and we'll address them at the end of the conversation. Now, with that, I'm so excited for all of you to be able to hear from this group of folks. I am going to have them introduce themselves, and we will go in this order. We will start with Cook County Commissioner Michael Scott, followed by Mrs. Barbara Deere, a community advocate, and Dr. Arnold Turner, who is our Chief Hospital Executive at Provident Health. If you wouldn't mind introducing yourselves briefly before we jump into the conversation, Commissioner Scott.
Well, thank you, Shannon, and thank you for having us. Happy Black History Month to everybody, and happy Black History Month to my distinguished panel who's joined me today, and I want to thank them for being a part of this conversation. I am Cook County Commissioner Michael Scott Jr. In the 2nd County District, and I serve most of Chicago. I have Inglewood, I have East and West Garfield, North and South Lawndale, Little Village, River North, Washington Park, South and West Loop, and a tiny bit of Boston. And so, again, it is great to be with you today, and thank you all for joining us, and happy Black History Month once again.
Good. I'm like, what time of day is it? Good afternoon. My name is Barbara Deere, and I am the CEO of Metamorphosis Health. And as Ms. Andrews said, a community advocate, and I believe wholeheartedly in holistic health. Healthy movement, healthy eating is so important. And my late husband was the previous commissioner, who was the Dr. Dennis Deere. So thank you. I'm happy to be a part of this Black History conversation.
Thank you, Shannon. Good afternoon. Happy Black History Month. I'm Dr. Arnold Turner, Chief Hospital Executive of Provident Hospital. Since this is Black History Month, I'll say that Provident Hospital was the first African-American hospital in the United States. It opened in August of 1891 as the Provident Hospital and Training School, and provided the opportunity to African-American women to become nurses, because at that time, the nursing schools in this area were not accepting African Americans as students at that time. It's a pleasure being part of this distinguished panel. I look forward to our discussion.
Thank you so much. So as you can see, we have brought together an amazing group of folks to talk about this topic. It is worth stating that while we are at the end of Black History Month as recognized in, if you will, a national level, here at Cook County and at Cook County Health, we believe that we celebrate the history and the legacy of the community every day. It is woven in our mission. It's a major part of our strategic plan as we look for ways to serve the community. And so with that, I would like to say that Cook County Health has long understood the role that food specifically plays in healthcare. It supports the physical and mental health of the communities and the individuals that we serve. We have looked at food-focused initiatives, quite frankly, for long before food as medicine was a concept. We've screened patients, connected them with food resources. Because we serve both as a hospital and a government entity, we are in a unique position to influence and or direct access and resources for people. I want to take a moment to say very specifically that Cook County Commissioner Dr. Dennis Deere, who passed away in 2024, was a tremendous advocate for this idea of food as medicine. And a bit later on, we're going to ask Mrs. Deere to share some of where that came from and the relevance and the importance and how important it is for us to build on that. And quite frankly, he supported the healthcare system and, dare I say, pushed the healthcare system and his colleagues at Cook County proper to think about food differently. And with that, I think I'd like to start, if you don't mind, with Commissioner Scott. Can you talk a bit about why you think food as medicine is an important concept and how it aligns with the larger Cook County obligation, if you will, to serve and support its residents in the community?
Well, yeah, thank you, Shannon, for that question. You oftentimes hear our county board president talk about healthcare being a human right. I believe that's the case, and I don't think health should be determined by their zip code or their access to food and healthy foods. For many residents, especially underserved communities like the ones in which I serve, lack of access to nutritional foods leads to higher rates of diabetes, heart disease, and other chronic illnesses. That's why I believe food as medicine is so important throughout Cook County and the Cook County health system and county care. We're treating food as a part of healthcare, right? And so connecting residents to medically tailored meals, nutritional support, so that they can better manage their health. This is all about dignity and it's all about prevention. It's a way of making sure that every resident has a fair opportunity to live a healthy life in Cook County. That's the kind of Cook County that I'm working to build, and that's the kind of Cook County that I know the health system is working to build.
And we are so grateful not only for your partnership, but your leadership on the work that we're doing around this and how we're trying to lift it up. Mrs. Deere, if we could talk a bit, as we have noted already, your husband was passionate about this work. I can't begin to share with the audience the number of meetings and community partners he brought together in a just, and no pun intended, very organic way to talk about real life lived experiences and appreciating that food as medicine was more than we will all uniquely, and those in the audience will appreciate. There was a time when people only thought about food through the lens of, well, I got to avoid salt for my high blood pressure, and maybe I shouldn't eat too much of this because it's going to impact my sugar. He wanted to take it next level. And so I'd like to ask you, why did he feel so strongly and why was he so passionate about this? And how does it feel for you and your family to see those efforts come to life and to continue to impact the community?
Yeah, to answer your first question, why was he so compassionate about healthy eating? First, Dennis came from the west side of Chicago. The west side of Chicago has always had issues with being a food desert. And he, number one, wanted to make sure that people had access to food. And number two, he wanted to make sure that people had access to nutritional food. And then over the years, as the world knows, Dennis did struggle with some health issues, and then he had to have a double lung transplant. And in talking to his doctors and the nutritionist, he basically was told that he needed to lose 100 pounds. So that was a big reason for him to totally get that he needed to change his eating habits. So he, decreased sugar, started eating more fruits and vegetables, more fish and healthy foods, and was able to lose 100 pounds. So, and within less than a year. So that's a big feat. So again, that was a main reason that he wanted to do that, to make sure that he could share to the world that if you change your eating habits, you could fight against some of those chronic conditions like obesity, high blood pressure, high cholesterol.
And can you talk just a bit about what that impact was for your family and for the larger community as you watched him shift his perspective on food as it relates to the impact of the body? Oftentimes, even when access isn't an issue, one thinks about what am I having for dinner, not what am I putting into my body for fuel. What was the impact to your family and your extended family watching him on that journey?
Yeah, it was really positive to see, to watch him on that journey. I often laugh because over the past 20 years in the house, I was always on this journey of I was vegan and then I was vegetarian and now I'm pescatarian. So when he decided to change his eating habits, I didn't have to cook two separate meals because he was on board with eating healthy. So it influenced the whole family because everybody was, eating more nutritious. And then, it was really nice to see him pull together like the community meetings and the lives that where he would talk about healthy eating, healthy nutrition, where just community members could come on and learn about it. And there was a goal and there was a movement goal as well as the nutrition. And then as Commissioner Scott mentioned, like partnering with other organizations to help bring in those healthy meals and, dietitians and medically tailored foods. Combined, it touched everyone that was involved.
And I think that's really important for our audience to hear because in Black History Month, as we talk about community and the role that we all individually play in this, I think what you just spoke of is really relevant to our listeners to think about. If you change your approach and your thought, or if you can change one person in your house or in your family, your extended family's approach to it, the impact is to the community. It starts with you and then it spreads to your family. And then ultimately, as we look at ways to lift up the community, this is something that can have a just life altering impact when we think about it through that lens. With that, I'd like to turn to our medical expert. Conversations about food, nutrition, and culture are essential in the healthcare because food is not just fuel, it's identity, it's prevention, it's healing, it's all of those things. Dr. Turner, can you talk to us a bit about what role what role should one's doctor or can one's doctor play to ensure that this concept of food as medicine is both attainable and culturally relevant and appropriate and meets the needs of the community?
Thank you, Shannon, for that question. Let me approach that question in this manner. Physician, uh, one of the things we have to do is educate the patient, give them what they need so that they can be successful in maintaining their health and also achieve the desired outcome that we want. So it's a partnership between patient and the physician. I, as a physician, can't be successful in treating diabetes unless I have a conversation with my patient about their diet. I won't be successful in treating hypertension and have the outcome that I want without talking about the patient's diet. If someone has heart disease, I won't be successful and have the desired outcome unless I talk with the patient about their diet. Even if I have a healthy patient in front of me and trying to just coming to me to maintain their health, I cannot maintain their health properly unless I have a conversation about their diet. So one of the things we have to do is share with the patient that food is a medicine just as what they get out of the pharmacy from the prescriptions that we read, and they're just as important as taking these those pills. Um, it's not enough just to recommend diet, though. We need to make sure that the patient has access to food. As we know, there are areas in Chicago, as Barbara did mention, that are food deserts. So we have to screen for food insecurity. It's one of the things we do here. We make sure that there's access. If we find that there's a patient that has food insecurity, there's some resources that a physician can turn to their social worker or access a social worker to find out what programs the patient may be eligible for to help them get food. Community resources that are available. Uh, there are a lot of organizations, particularly churches, that have food pantries. Now, we'll certainly come back to that a little later. But talking about food, making sure giving the patient the information that they need to know about food, know why we eat. We just don't eat because we get hungry, but the reason we eat is to provide an energy source for our body so it can do all the things it can do, provide body with the things that it can't make, that it requires to run and build, nutrients, amino acids, vitamins, and also to buffer the acid in the stomach. Um, with respect to, we also have to keep in mind the patient's culture. And this being Black History Month, we can talk about the diet of African Americans here in this country and in Africa, that the foods in those diets are nutritionally sound. Okra, beans, and greens are nutrient dense. They're superfoods, provide a lot of vitamins, minerals, antioxidants, which are essential to limiting inflammation and have a big role in preventing heart disease. So we have to get down on the patient's level with respect to talking to them about food as far as getting, and also keep it culturally sensitive. And that's where a dietitian really comes in hand. Getting the patient with a dietitian that speaks their language, knows their culture, if the physician is not aware of that. And for myself, since I'm sort of a foodie, I love talking to people from different cultures about foods and finding out what I can do to make some of my own recipes better. So, and that also helps you form a bond with your patient, which is very important so that they feel comfortable talking to you about whatever it is that's bothering them, what's impacting their life. And food is a common avenue for starting those conversations.
If you could pick up just a bit more, I love that you approach the reality is that we all know the tropes that come with the notion that there are some folks who might look at a culture and just make assumptions that that culture eats a high or heavy in content of this. I think you really hit on something in what should could be really important to all of us, not just the communities that we serve, but all of us as we think about it. It sounds like you're talking a bit about it's important not to label a culture of food in just one way. To your point about Black History Month, what we know is that as a community of people, you know, post slavery, during slavery, access to food is from a cultural perspective, that alone does not define, but there are ways that you can approach it. If you could talk a bit about, from the patient perspective and from the doctor perspective, why is that important? Why is it important to understand that you can find what is healthy and nutritious within a culture of food without sending people to a space or something that is unfamiliar or that is not culturally relevant to them in that way? Can you just expand on that a little bit?
One of the main reasons that that's important is that if, in addition to bonding with the patient, you also get better compliance with what you're trying to do, the changes that you're trying to make. If you can point to a food is a mainstay in a patient's diet, talk about how that adds value to their diet, to their bodies, helps plays a role in keeping them healthy, addressing the problem that you're trying to treat, then they're more likely to take that home with them. So I feel that you're trying to address them within their culture or level, and it makes it easier for them to be compliant with the changes that you're trying to make. All diets have some nutrients in them. Uh, the American diet, regardless of race, for a long time in this country, was high in salt, high in fat, regardless of who you were. That was unhealthy, but now we're trying to address that. And by making those changes, uh, can have an impact in the future because we all learn our eating habits from our parents. So if we make changes now, in the patient that we're seeing, whether it's uh, parent, grandparent, or someone who doesn't even have children yet, if we can change those eating habits, that will help lower the incidence of certain diseases that might impact them, uh, like diabetes, hypertension, or even if can't escape our genome. So even if they do develop, there are less serious cases. They'll know how to manage them. They already have a step up on somebody who's not taking the time to eat correctly, have the proper diet, bond with their physician to know how the things they can do outside of the clinic visit that can be impactful on health.
All right, folks. So you heard it directly from the doctor himself. We appreciate that, and I think that and it really takes me to the next question, which I'm going to throw your way, Mrs. Deer. Can you expand a bit about? We talked about this a bit earlier in terms of how and the role and the impact that Commissioner Deer's perspective and change and shift in the approach to food had. Can you talk a bit about what that looked like practically for you and your family? I know you talked a bit about how you were able to adjust as it relates how you approached cooking as a family. And I want you to do it through the lens of as you share that experience or expand on that experience, what would be your counsel as just a mother, as a wife, in terms of an approach to how to help families and ultimately the larger community think about going down this journey of thinking through. We're going to talk a bit later about the role food insecurity has in that and resources. But for those where you have resources, even if they're limited, or you have an abundance of resources as a community, what was your approach and what are your thoughts about what could be helpful for a family to think about in terms of approaching this?
Yeah, one of the first things that I think about is eat to live instead of live to eat, because what we really are what we eat, and we can have some control over our health based on the decisions that we make. So in my house, I just try to like implement healthier meals. So something that Dr. Turner said stood out because he talked about like even culturally certain people eat certain foods, but there are ways to modify foods to make them a little bit healthier as well. So I think learning healthier ways of changing a meal that you really like is something that helps a lot. So for example, like when I cook black eyed peas, I find the crock pot to be really easy to make those type of meals. And we know that's a traditional meal. My mom always made it for New Year's, and all throughout the year, we ate a lot of soul food. But so when I make it instead of meat, which that's fine, but for me, just using more herbs like real garlic and bell peppers and just all of the flavors that you can put in there to season it. So I think seasoning things differently and keeping health in mind helps people to make those different decisions. And I just wanted to share this too. I always share, my dad lived to be 101 and my mom is 90. And when we were growing up on the west side of Chicago, we always had an extra lot and there was a grapevine because my dad grew grapes well, we all kind of had to pitch in all the time, but an apple tree, a peach tree, greens, tomatoes, onions, mint. So we grew up really literally eating a lot of those foods from the garden or the fish that he made. But I always look at the difference. Just the oils that they used was definitely traditional, but they were always exercising or work in the garden because they were retired. And so it's just movement and choosing healthy foods and then modifying them where you keep your flavors, but reduce the sodium, reduce some of the meat. You don't have to let go of everything, but just reduce some things. So
I like that concept of it. It's a process. It's not, I mean, if you want to potentially be set up for failure, it is I'm going from this to some extreme the other way, then there's no time to acclimate to it. But it sounds like you really, your approach to it has been, how do I take the things that I have and what I'm using, and how do I think about it differently in terms of what are the other options and choices. I love that. And I'm assuming, I mean, look, 100 in the 90s, I think that we can all agree longevity is in our DNA. What we're talking about, our ability to withstand and to endure, there is a legacy and a history of that. I really think that this notion of food as medicine is really about an approach and a way to try to impact things in a creative and different way that's not all about the medicine. Medicine has its role clearly. We just believe that food can be equally as important. And so when we talk about food as medicine and making those kind of choices, what is also real is that that is not oftentimes a luxury that everyone has. We've all heard the stories and can appreciate, and it's not lost on any of us, that sometimes this is a conversation where if someone is struggling with where is the next meal coming for my children and or my family, it can feel like a luxury to think that you have choices and that this is a space that you get to make choices in. And so one of the things that we're going to shift to a bit now is talking about food insecurity and the importance of access to food through a lens of nutrition and food as medicine. I'll talk a bit about, and then I'm going to tap into and ask Commissioner Scott to help with this part of the conversation as it relates to access. So beyond food deserts and benefits and things that are in place to assist community members who are struggling with food security. Here at Cook County Health, we have partnered, and under the leadership of Dr. Eric Makaitis, who's our CEO, certainly Cook County Board Commissioner Tony Preckwinkle. We've talked about the legacy and work of Commissioner Deere, and of course Commissioner Scott, and the work that he and his colleagues lead on a regular basis. We've been able to partner with the Greater Chicago Food Depository and stand up two food pantries, one in Belmont Cragen at our Belmont Cragen clinic and one at Providence Hospital. We are actually looking to expand to the Robbins community in the south suburbs. These programs started out as pilot programs, but the way those pantries work, because there are other pantries in the area, is when patients come into that clinic or into the hospital, if they identified as food insecure, and if they have a health condition that is impacted by that, and that list is long, it goes beyond diabetes and hypertension, they can receive a referral and a voucher to the pantry where they are given access and resources to food that's provided by the Greater Chicago Food Depository. But we also have the lens and the assistance of dietitians and nutritionists to talk about the food that we're making available there. How can your approach to cooking that food play a role in terms of helping you try to address those needs? And I think that that really is a very good example of how we've thought about food as medicine in a different way. Then, of course, there is SNAP and SNAP benefits. Commissioner Scott, as you know, as an elected official, we are in challenging times as it relates to some of the changes that have come out of the federal government. Could you maybe talk a bit about, that's specifically with SNAP, could you talk a bit about concerns related to that and what you think community members who are facing food insecurity and who are a part of this program or thinking about becoming a part of this program? Could you talk a bit about um, the impact of that and resources or tools or the
Yep.
relevance of what's happening there?
Yeah, well, thank you. I think that's really important. Right now, the federal government has been very unpredictable as it relates to SNAP and funding for food support access programs, right? So that certainly brings understandable concern for our families who rely on these resources. What I want residents to understand is that SNAP still remains available, even with new work requirements, and that is, if you're 18 to 64, you have to be in some kind of training program or working in order to do that. Um, if you qualify, I want you to continue to apply to make sure that you are recertified re, as your requirements for your benefits are not disrupted. Don't assume that you no longer qualify for these benefits. It's not automatically stopped. You have to continue to apply without receiving official notice you're still on. And for most people, their SNAP benefits are up to date, and their eligibility still is there, right? And so, for any federal changes, I strongly encourage any of our residents or folks who are dealing with this to visit the Illinois Department of Human Services. They're at abe.illinois.gov or call DHSS for DHS. I'm sorry, hotline at 800-843-6154, or you can call my office directly. We love to walk people through what they need to do and how they need to do it. Nobody should have to go through this alone. So, please don't hesitate to reach out to us. And then remember, to DHS, their website and their number, and then we can put that in the chat a little bit later, Shannon. But we'd love to help folks who are experiencing loss of their benefits.
Absolutely. And we're super grateful again for your leadership and partnership on that. To that end, we have stood up some food as medicine educational resources. We've got an education campaign going on right now. You can visit our website and click on food as medicine or do a search for food as medicine there. And we have information related not only to the concept of food as medicine, there's culturally relevant content as it relates to cooking tips and resources, but we also have links that will get you to our appropriate community partners and government partners who can help you through this.
And Shannon,
Mhm,
I want to also offer, we talked about doing more of these. Maybe we
mhm.
can do one about, specifically about SNAP and how to access those. And if you're having a program that supports your nutrition, how you access those. And I would be willing to join on those as well.
Absolutely. As always, your leadership on this and it is unbelievably important because these are scary times, and we just need the community to know that you are not in it alone and that we want to be a resource and a tool. And even if we are not the place that you can deal with the issue at, we can certainly be a resource and tool to help with that. Dr. Turner, as we look ahead, can you talk a bit about the impact of the pantry at Provident, but as well, what do you think the success of looking at food as medicine in our communities, what does it mean for patients and families if this approach became the norm? If people having access to nutritious, healthy food, and if they could think about it in that way, the work that's going on at Provident, what could it mean for the community from a healthcare expert's perspective?
Well, first, talk about the food pantry here at Providence. It is a great resource for our patients and for our physicians to have that available for our patients. Our food team works with our clinical staff on getting referrals for patients that are challenged with obtaining food and get nutrition guidance as far as resources and nutrition information. We're not just providing food, but we're also providing some education about food, awareness where they might be able to access food, healthy food options. So our objective is to educate uh, with, by educating the patient on, again, on their level with relevant content, uh, relating the content and making it sensitive to patients' lifestyles and cultures, so making the culture relevant, and empowering patients with with the knowledge of healthy choices. As already mentioned, get more information at cookcountyhealth.org, FAM, Food is Medicine, for more information on that. Looking at success, we'll have success in this when food and nutrition is integrated in all the treatment plans and things that we're trying to treat as physicians, as healthcare providers. That is just like getting the patient to take their medicines. We're only going to be so successful with medicines alone. We know that key lifestyle changes are as important to having a successful outcome in treating whatever we're treating, whether it's diabetes, hypertension, even cancer, even on the preventive side. Food has a role, exercise has a role, preventive screening testing, all that has a role. Food is just one of those things that is essential to maintaining your health. If food as medicine becomes the norm, uh, like I said, we're not just treating that individual patient, it can have a generation effect. As I said earlier, uh, we learn our eating habits from our parents. So if we change those habits, that change can last for a long time, help prevent diseases in our future children, grandchildren, great-grandchildren, and just help our community thrive. So screening people for food insecurity is very essential and important. Having access to resources to help those who are challenged is very important. If we integrate all that into a care plan as an approach to not just take care of the individual patient, but the population at large, we will be successful. We have a much healthier community in the years to come.
So, Dr. Turner, let me ask you this. Would you agree, or what are your thoughts on for our listening audience? If their provider hasn't mentioned food as medicine or a concept, should they feel empowered to ask their provider or doctor, is there something they should be doing differently with their eating habits? Is that what is a patient? If I'm not a doctor and I'm intrigued by this concept of, I wonder how my eating is impacting my healthcare in these numbers, would you encourage them to have that conversation with their medical provider?
Absolutely. I think in order for you to maintain your health, as stated before, it's a partnership. It's a partnership between you and your physician so that you can decide what is best for you and how you're going to achieve that. If you're having concerns about your diet, just like if you had concerns about a knee that's bothering you, you would bring up that knee problem. So you should bring up your concerns about your diet, what changes, how you can make changes to make your life better. So absolutely, that should be a free conversation that should take place.
I love that. And as Commissioner Scott said earlier, here at Cook County and Cook County Health, we believe that healthcare is a right, not a luxury, but it's a basic human right. So thank you for that. Uh, Mrs. Deer, as we start to close out the conversation and as we celebrate the close of Black History Month, but again, I know that everyone on this call is at the forefront of ensuring that the rich history of the community and the legacy of the work that has been left behind is carried out every day, every month, all year long. Can you tell us, and as we honor the good Dr. Commissioner Dennis Deere's legacy in life, what message would you want families to take away about the power and the role of food and food as medicine in the community, in our community specifically?
I would want to leave with people and the community that choosing healthy foods and healthy meals and just making that lifestyle change is so important to maintaining good health. And Dennis, the late Commissioner Dennis, Doctor, I have to put all these titles in here. Dr. Dennis Deere was an advocate for that and for setting goals and seeing them through. And he really learned that when he set the goal to lose 100 pounds, and that helped him to improve his health during that time period. So that's what I want to leave people with. Set goals. Remember how important it is to choose healthy foods and eat differently. Eat so that you can live a good, healthy life.
That's an amazing legacy and something that we hope to continue to build on. I'm getting ready to throw Commissioner Scott a slight loop because he does not know this question is coming to him, but I've known him for a long time. And the public service in him runs deep. It's in his DNA. When I first met Commissioner Scott, he worked for the Chicago Park District. And so I would argue you have a unique perspective on health and the role that it plays in the community. I knew you when you were planning, programming, and ensuring that the Park District was meeting the needs of the community. Before I kick the final question to you, I wonder if you might talk a bit about what your career through both at the city and at the county and the advocacy and the role that your family has played in being connected to the community. Can you talk a bit about what that career and that perspective of healthcare and the park district and food, how that all comes together as an elected official?
Well, one, as an elected official, it is really important to be honest as a public servant, not just as an elected official, as a public servant, right? You are looked at as a trusted confidant in the role that you play, how you interact with people. They trust you, and so one of the things that I learned very early in my career is if you can't see it, you can't be it. And so as an elected official, as a public servant, as somebody who has deep roots in the community, I have always tried to project an image of one, giving back, but two, healthy lifestyle, making sure that you can't be a physical instructor at the Chicago Park District and not run around, not be healthy, not engage with those children. So it is important as an elected official. And one of the things that I really admire about the late great Commissioner Dr. Dennis Deere is, when he put his mind to making sure that healthy lifestyle was going to one help him, but also help his family. He, adjusted and did that, and he put his mind to it, and he made that happen. Um, and it is important as an elected official, again, if they can't see you as an elected official, being healthy, being out in the community, being a part, being active, eating healthy, those things really translate into making sure that folks who really listen to your message, it resonates with them. And so, again, I appreciate the work that the late great Commissioner Dr. Dennis Deere kind of pushed me in this direction of health as it related on the city side and making sure that people knew about this message. And so, being that trusted confidant to folks and making sure that people understand that you are not only doing the work, but you're living the work.
I love it. That is a great response. I'm going to ask the producers, the folks behind the scenes here, before we close it out. Do we have any questions that we need to address Okay, very good. I think we don't have any questions. I will say before we close this out, if there are any final remarks from our panelists on this, I think that you have all been a tremendous part of this conversation. I'm so grateful for you for jumping on and joining us in this conversation. I think it's so important for the communities that we serve to see and to hear in real time and in a very practical way what the thought process is around some of this programming. And so it was my honor to moderate and to be a part of this discussion. And if there are no closing,
I have one. I do.
yes, please.
I want to say thank you to you, Shannon, for being an excellent moderator, making sure we kept this community conversation moving forward, and highlighting the importance of food as medicine and health within our community, specifically during Black History Month. So I want to thank you for that. I want to also thank our distinguished panelists who were here. I know that Barbara Deere has other things to do, but I know you found it important for you to be here. So I appreciate that. Appreciate you, Dr. Turner, for your wisdom and what it is that you're doing and helping our communities move forward healthily. And then last but not least, I want to thank Commissioner Dennis Deere, who was a brother to me, who was my partner in good government, who championed this work, who kind of led me into this work. And so want to thank him for all that he has done. His legacy and memory continues to resonate throughout Cook County with all the great work that he has done, not just in healthcare, but across the county. And so with that, happy Black History Month. And again, thank you all for being here.
Thank you so much. So, thank you for those who joined us for this conversation. I think we will have a link to the live stream of this. I think the team would be very disappointed in me if I didn't encourage people. If you want to learn more about this work and what we're doing, please feel free to visit our website, the Food is Medicine program. You can find us at cookcountyhealth.org/FAM, FAM. We are grateful to all of you. And please, as Commissioner Scott said, this is really a journey, not a destination. This is not the only conversation. This is not the only time that you will hear us talking about this work. So thank you again, Commissioner Scott, for your leadership on this. Thank you so much, Mrs. Deere, for joining us and for continuing to be a part of the Cook County family, the Cook County Health family. And Dr. Turner, as always, it's a pleasure to be able to sit in these spaces with you as well. So to all of those of you who are listening, happy Black History Month, and we'll see you next time. Take care.